So Yuri, thanks for joining me. You probably noticed we've got a lot of kids on the unit with agitation. And so I wanted to be thoughtful about how we approach the unit and how we address some of our patients today. Acute agitation is a pretty serious thing. And so we want to be mindful that an ounce of prevention is worth a pound of cure. So when we go onto the unit today, we'll want to make sure that we're wearing loose clothing so that we can easily move and make sure that we're responding to our patients. We're going to want to make sure that the door closes behind us, right, so that the unit's secure, and be mindful of the emergency buttons on the rooms that we're in so that we keep ourselves safe and everyone safe. The other thing we'll want to be thoughtful about is where we sit. We'll want to make sure that we have access to the door and that we're not putting patients in between us and our exits. So agitation, it's a common presenting symptom, especially for children and adolescents. But when we think about it, we really consider agitation kind of like medicine doctors consider fever. It's a symptom, but can be representative of a lot of different circumstances that bring kids into the hospital. So when we're thinking about agitation, the first framework that I like to think about, for kids anyway, is from a developmental perspective. Is there any kind of developmental lens through which we should think about these kids that might help us explain why agitation is such an issue for them? For example, is there, say, a language-based learning disability in this particular kid that makes this human a little bit more vulnerable to using aggressive behavior to get their needs met? That can be a pretty common source, especially for younger kids that are struggling with that issue. The next kind of framework I like to think about is from a behavior perspective. Is there any triggers that we're not paying attention to? Are there kind of aspects of this kid's presentation that we're kind of engaging with that result in agitation? And is there a way that we can change our behavior to both reduce triggers? Are there any consequences to the agitated behavior that are unintentionally reinforced by us? Are there ways that we can kind of be thoughtful about this aggression actually being a maladaptive but rational choice to get certain needs met? The other way that I like to think about kids too is from a psychological perspective. Is there an underlying kind of psychiatric disorder that might put these kids more at risk for using agitation to get their needs met? So for example, is this agitation kind of acute, or has this been going on for a long time? When this has been a pervasive pattern of engaging in the world, I'll think more about oppositional defiant disorder or conduct disorder. When there's big mood symptoms associated with the agitation, my mind will move more towards, say, DMDD or even a bipolar diagnosis, wondering if this is an expression of a major mood event, but otherwise not characteristic of the way that they behave. And I don't want to forget about depression, right? Depression, we think about, depression as a way that kids might feel sad or withdrawn. But for kids in particular, they can feel irritable when they're depressed. And so that kind of irritability might come off as depression. Or when depression gets so far advanced, there is even some psychotic features that can be associated with it. And agitation might be associated with those psychotic features of depression. And last but not least, we want to be thoughtful about kind of how acute or spontaneous this agitation is. Is this an impulsive kind of act? Is this more associated with attention or concentration? And in those circumstances, we might be seeing this as an extreme version of ADHD. Lots of different things are on our differential. But when we're thinking about our response, right, we need to think like how acute or how much of an emergency is this? Thinking about kind of the source material for the agitation might drive medication choices. But when it's an emergency, we want to be prepared. We want to know what medicines we have available to us pretty immediately. No medicine that we need to ask for that's all the way on the other end of the hospital at the pharmacy there that takes 30 plus minutes to get to us is that useful. So we'll want to know, again, be prepared by knowing what's in our Pyxis, what's available to us, and think about using that medicine first. We want to make sure our staff knows how to use that medicine and can deliver it efficiently to patients. But in more ideal circumstances, we always want to think about treating aggression or treating agitation with as many kind of thoughtful or therapeutic interventions as possible.